Good morning, and I'm Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control here at the University of Kansas Health System, and I'm in for Dr. Steve Stites today. And we are coming to you from the Dolph Simons Jr. Family Broadcast Studio. I have Amanda Cackler here in studio with me to help us answer your questions. And a little bit later, we will hear from Chelsea Smith with the Community Blood Center of Greater Kansas City. They are having a severe shortage of blood and blood products again, but it's not what you might think. First, I have our numbers. So Hays has one active patient. We here at the health system have 6 active infections, 1 in the ICU but none on the ventilator, and 12 additional that meet that recovery criteria. So 18 total patients, but only 6 with those active. And again, a majority of those are those asymptomatic patients, so that is another good thing. And I think if we can keep seeing that, and if some of our colleagues and other hospitals around the metro area can continue to see lower counts. We know that Dr. Stites had talked about the CMO call we had earlier this week, and there were a couple hospitals that were above us, and those are active and symptomatic patients, but hopefully those numbers can keep going down. We know in the Kansas City metro area, for one reason or another, the daily average is below 100, and the new cases, the 7-day rolling average is below 100, and I think the daily new cases for the last couple days have continued to maintain under that 100 cases per day mark. So with that being said, do we have any media questions?
Hey, good morning. Cody Holyoke with Channel 9.
Cody, hey.
Hey, let me pull up my questions here. I was having some technical issues. The Washington Post took a deep dive into data from all over the country recently and pointed out that case numbers nationwide seem to be rising, specifically in unvaccinated people. Some health officials who were interviewed were worried that this is because, and we've talked about this before, that people who've gotten their shots are going about life as if they have. I'm curious, does this rise they're reporting about echo what you're seeing? If so, what's behind that, and what are your concerns?
I'm sorry, you broke out a little bit. Is it the unvaccinated people that are going about their lives as if they have been vaccinated? Is that right?
Well, there's that, but the report was mostly about how case numbers nationwide seem to be rising, specifically in unvaccinated people, and just curious your thoughts on that.
Yeah, I mean, I think that's totally what we see. That is what we expect. Vaccination, protects you from the whole spectrum of symptomatic and asymptomatic disease. If you have people that are vaccinated, that virus is going to find those unvaccinated, those unprotected people. And I think that is, this is the function of what we are seeing. When you get vaccinated, you protect yourself, you protect your community. But if you remain susceptible to the disease, you have a good likelihood of getting that. You have a higher likelihood of having to go to the hospital and having severe disease and death as well. And that is really the basis of what population or herd immunity is. You try to reduce those number of people that are susceptible to infection and disease, and you do that by vaccination or natural immunity. In this case, we really need to do that through vaccination.
Yeah, I think that's consistent with what we're seeing in the hospital, that the majority of our patients that are coming in who test positive, we're finding just by the admissions screen, and they are, our vaccinated folks are typically coming in asymptomatic, which is what we would expect to see. It is the folks specifically in the ICU generally are those who are unvaccinated and have come in with symptoms. So that's exactly what we would expect to see with the vaccination status.
And then just a quick question. I mean, this is really our first real holiday weekend where health officials say it's possible that we can actually go see each other unmasked. And so millions of Americans are expected to travel. What should people keep in mind this weekend?
I think my first little tip on that is unmasked is really for those who are vaccinated, and it's not a free-for-all for everyone. The CDC has been very clear that the public health guidance for unvaccinated folks is still to be masking. So I think that will be very important and something to take into consideration for your own personal decision making is understanding your risk and your bubbles risk related to to transmission and what their vaccination status is. So my recommendation, even though I think that the message is out there, people's understanding is that it's kind of a free-for-all and go back to normal. I think we need to be really aware that the risk is still there. We still are seeing hospitalizations, and that we need to be careful and really be thoughtful about what activities you're involving yourself with.
Yeah, we have to remember, just as you said, the reduced restrictiveness of needing masks is for those fully vaccinated people. Last year, a year ago, we saw that people were having large get-togethers, and we saw those in those places like the Lake of the Ozarks. I think that was nice because the weather was nice. Right now, it looks like this weekend the weather's going to be cold, so my concern is that people are going to be getting together indoors rather than doing things outdoors. I would definitely feel much more comfortable if those get-togethers were done outdoors, where we know that that risk is much less. But also remember that all of that mask guidance is for those that are fully vaccinated. If you are not fully vaccinated, please continue to wear your mask or avoid those situations or try to do things outdoors, and especially, maybe do a combination of all those things.
Thank you.
All right. Jill.
All right. We do have one question that came in this morning before we get to our pre-questions that we've already collected through the week. Sherry wants to know if you could comment about the outbreak of COVID in north central Missouri, specifically Livingston and Lynn Counties. What do you know about that?
I would have to probably look into more details in regards to what their rates are and understand more about the uptick there. I think it's important to recognize that we're still doing the same response for known outbreaks or significant increases, that there still are contact tracing activities happening. That guidance on quarantining and isolation really hasn't changed for the unvaccinated folks. So I think the response is likely going to be the same as it would have been a year ago. But I personally would need to look into that a little bit more to have the details specific to that.
I think it's multifactorial. So first of all, looking at the data and the data collection and how it's presented, I think, is important. Also, we do know and understand that rural counties throughout the United States, there has been lower uptake of those vaccines. We know that they have a large supply that are needing to ship out because they are almost being expired. So we know that the uptake of the vaccine is low. Also, was there an event or two events 3, 4, 5 weeks ago that maybe led to this super spreader events? Are there congregate living facilities in that county or in those counties, such as prison or nursing homes, maybe that may not be fully vaccinated, just as things that we saw before? Or are there food processing plants, as we saw it have a devastating effect in Kansas a year ago, when those food processing plants in that county with that food processing plant and was hit very hard, and it had a high per capita amount of infection. So I think it's multifactorial. Really look to understand some of those details. And again, what are the ages of these infections? And also, how is that affecting the hospital capacity? Are a lot of these infections due to maybe young kids getting together, getting out of school, where there are parties or graduations? It's really unclear. We know when we see surges, though, it's probably a function of what was going on 2 to 3 weeks ago. Also, just look at full testing, trying to get as much testing as possible to really get a better handle on the total number of people being tested, the total denominator, finally being able to get the most accurate data. So again, I think it's a multifactorial question and a multifactorial answer as well.
Okay, and then Christy has a clarifying question. She said, if the people who are asymptomatic and vaccinated likely to spread COVID, curious about the idea around unmasking if there is still a number of asymptomatic vaccinated people. Confusing.
It is a little confusing, and I think that there's still some information that we have yet to learn around this. We know initially that the vaccine protects yourself from that severe disease, hospitalization, death. But we also know that it can impact it reduces the likelihood of you to be a spreader. If you have less of that viral load, it's probably less likely that you're going to be transmitting it to others. But it's still important to then know that vulnerability of the folks that you're spending your time with. So I think the initial question was, can you still transmit
Yeah.
disease if you have been vaccinated and you're asymptomatic? I think the risk is there, but it's significantly lower than if you were unvaccinated.
Yeah, I mean, I think we're not going to say an absolute and just say, no, you can't. We do, from real-world experience, and again, small published studies looking at actual viral loads in people's respiratory tract without vaccination and with vaccination, and those are lower. So your ability to transmit the disease if you are fully vaccinated is significantly lower. We know that there is going to be a large collegiate study going on with, I think, 12,000 people, where they are going to try to be answering that specific question. So will we have a better answer? But right now the answer is the ability to transmit the disease after full vaccination is significantly reduced compared to unvaccinated.
One more.
All right.
Janet wants to know, she says, my granddaughter is fully vaccinated and will be around unmasked, unvaccinated people. How long does she need to quarantine before coming to see us? I am post-transplant.
Yeah, that's a great question.
It is a good question, and I think that's a tricky one. So the CDC suggests that, and I think we've had plenty of data that backs
Yep.
this up, that suggests that if you are fully vaccinated, it is safe for you to be around unvaccinated folks. The risk for being unvaccinated is really posing that greater risk to other unvaccinated people. So I don't know that there would be any real recommendation to quarantine after being, unless, but even in that situation, if somebody were to come back positive who is unvaccinated or vaccinated, there's not guidance right now to isolate yourself if you've been, or quarantine yourself from folks who have a positive diagnosis unless you have symptoms. And so I would probably suggest just monitoring for those symptoms, but not a real recommendation on quarantining post being around unvaccinated people.
And now you're kind of getting into the art of medicine and science and the guidance. Really, you have to understand what is your risk. If you're a transplant, we do understand that even if fully vaccinated transplant patients, there is a significant proportion that don't necessarily develop antibodies, but there are other things to immunity, not just antibody levels. So, but your risk of getting the disease and outcomes may be a little bit more severe, or for those higher maybe more higher for those severe outcomes. So, number one, talk with your medical team and really try to maybe develop a plan. And again, the guidance, just as Amanda said, you don't necessarily have to quarantine if you are fully vaccinated. But now, if you are going to be interacting with somebody that you know is at higher risk, you may be able to develop a plan for yourself, where it is maybe a quarantine for 5 or 7 days and then going to get tested. So there's really no specific guidance. It's just how much of an abundance of caution do you want to take to try and protect those around you. So.
And I think Dr. Stites has mentioned before that some of his recommendations for transplant patients or really high risk immunocompromised patients is, the mask doesn't hurt anyone. So if you really have concern about anything, you can still mask and protect yourself from other organisms.
Yeah, and you're still able, after you get back from that get together, if you want to, quarantine for 5 or 7 days and then go get a PCR test, I think that's very reasonable. Again, abundance of caution. There is no specific black and white guidelines for that.
All right. Here we go. Is there a way to know for sure if my body effectively responded to the mRNA vaccine? I'm taking cancer medication and I'm worried I'm not protected.
Yeah, I think we've talked about this before, that there's not a test that you can go and get to identify what your immunity status is post-vaccine.
Yeah, I mean, again, the guidance right now is don't test. Don't test for antibodies. This is for non-immunosuppressed people. Even for the transplant population, the expert guidance right now and the AST guidance is to not check for antibody levels, because there are more things that contribute to the immune response than just antibody levels. Talk with your medical team. Understand what immunosuppressive drugs you're taking. We know that anti-metabolite drugs, immunosuppressive drugs, may increase your risk of not developing those antibodies or that immune response. However, the guidance is to not check. If you are concerned, continue to do those things, those non-pharmaceutical interventions that we know protect you: distancing, masking, doing things outdoors, things of that nature. But there is no real guidance to check immunity after getting the vaccines.
Do you ever think that children age 4 to 8 will be vaccinated for COVID-19?
Yeah, absolutely. I think those studies are
Yeah.
currently in progress, and hopefully we'll know something, I want to say by the end of the year. I don't know if that's realistic or not, but that's
Yeah.
sort of what I'm hoping for.
All right.
Yeah.
The COVID-19 vaccines do not cost us anything. Will the booster shots be free too?
I was looking for information on
Yeah.
this yesterday. I didn't find anything. I think it's going to be really dependent on where we are as a country, and if it still is a public health emergency that we need to get vaccine uptake. I really don't know the answer to that, but hopefully it won't be a financial reason that folks aren't getting booster shots when they become available.
Yeah, I mean, hopefully they will be, in order to keep us opened up, keep less restrictions, allow the economy to continue to improve and flourish, and encourage, especially, the essential workers, whatever that may be, whether it's our service industry workers, our supply chain workers, our teachers, our physicians, our first responders. Hopefully that will increase the uptake, without if they do not have an added cost. So.
Okay, will booster vaccines have to go through testing and approvals like the current vaccines?
I'm assuming there would have to be some.
Yeah, the latest understanding I have is no. Certainly they will be undergoing initial testing, especially for this first round of what we think the boosters are going to look like. We know Moderna is creating one with the South African spike variant in there. But if you remember, our vaccines for influenza every year do not go through that same approval process. So the platform is going to be the same. The vaccine is really going to be the same, except probably for that altered spike protein or RNA. So I don't think we anticipate that they will have to go through the same approval process and the long testing that the initial emergency use authorizations have gone through. And once and if it is fully approved by the FDA, I don't believe it will.
How long after having COVID-19 should you wait to get the vaccine?
So we've been, this has been part of our recommendation all along, is to wait that initial 10 days, that isolation period, and then you are able to get the vaccine.
Yeah, the guidance is there is no minimum time between infection and vaccination. So after you are safe and have gotten out of your isolation period and can be out in public, you can go ahead and get the vaccine.
I've had 2 individuals tell me that over-the-counter pain relievers taken to relieve body aches after getting the vaccine weakens the efficacy of the shot. Is that true? Can I take Tylenol and ibuprofen?
I know many folks did. I don't think that in the general public that is a risk for impacting the efficacy of the vaccine.
Yes, you can take ibuprofen or Tylenol for 24 or 48 hours if you have symptoms that will not affect the efficacy of the vaccines.
All right. We've heard of people being hospitalized after getting the Pfizer shot. Does this mean the shot is not 95% effective against COVID-19 as first reported?
So I think this one has a couple of things that we don't have all of the information about the hospitalized person. So are they being hospitalized for COVID-19? Are they being hospitalized for something else? I know our experience at the hospital has been typically when people have received or have been fully vaccinated, they are being admitted for something that is not COVID related. And then they are doing their admission screen and they are asymptomatic and they happen to be COVID positive. I think the short answer to that question is that does not mean that the vaccine is not effective. We are seeing that it is effective.
Yep, and even greater than our anecdotal experience, there was a publication in, I think, May 17th in Clinical Infectious Disease looking at Israel. Over 1 million of people were vaccinated, and they had the same exact outcomes as the initial trials with 30 or 40,000 people, showing that high over 90% efficacy. So all of that data from the trials that got the emergency use authorization, it is being backed up now by real-world data with larger numbers even showing the efficacy of these vaccines.
Okay, so question 8 we already answered. So I'm going to insert 2 questions, one from Kathy and one from
Yay.
Holly. Kathy wants to know, my latest CT scan shows ground glass lungs after COVID. What can be done for this? I am post-transplant. And you might explain what that means.
Yeah. So this is a radiologic term. It's just how the radiologists describe what they are seeing in the CT scan, and we see this all day. Every day we see this on people's CT scans for one reason or another. It just means that there are changes to your lung that don't look like a normal lung. It can be for a variety of reasons. It can be scarring, it can be infection, it could be a neoplastic or a cancer type process, or some other infiltrative process. It's just a general description, so it doesn't mean anything specific. Now, we understand that people after COVID-19 can have changes to their lungs, so this is not unexpected either. And people with mild or hardly any symptoms can have changes to their lungs, as can people who've had severe disease. You know, we don't really know the time frame right now. We have our excellent pulmonologists, I think they have 3 or 4 now, who are actually in their post-COVID clinic or their long-haul COVID clinic to address these types of things as well. I think you have to look at what are your symptoms, how is it affecting your daily life. Those are things that we address in our multidisciplinary pulmonary post-COVID clinic, especially our pulmonary or lung doctors as well. So again, it's a non-specific finding. It could mean a lot of things. If you've had it after COVID, it is probably some degree of scarring or still some of that fluid and cell-free fluid and all those cells and that inflammation that you had in your lungs when you had COVID-19. We hope that it will eventually resorb or resolve as your body just kind of takes it back up into the body and clears it from the lungs. But we don't have good data about that yet. It's going to be a slow time process. And again, we've also heard about people who've had improvement in their symptoms after vaccination. So if you haven't been vaccinated yet, please get vaccinated. That may help with some as well. And again, that is another question that continues to be investigated. Do people really feel better if they have long COVID and they get vaccinated?
Okay, Holly, and I'm going to squeeze Joe in here because they have similar themed questions. Holly wants to know, indoor youth sports, should unvaccinated kids still mask? And Joe says, I'm starting to walk with someone who won't get the shot. Should I mask or ask them, or we both go maskless?
So I think on the walking partner, I think you can, if you're fully vaccinated, the other person's not vaccinated, you know, the recommendation is that they are still masking.
That they would.
Yeah, the fully vaccinated person, it is not necessary. But you could do other things. You could socially distance. You can still have a walking partner and stay 3-6 feet apart. Outdoor walking better than indoor walking. If it's from a single household, the risk there is probably really low.
And I think if you are considering that from a single household, you probably can do it, especially if you're walking outdoors. It's probably very low. Obviously, the risk to that other person is going to be greater.
The indoor sports, where you have unvaccinated children, and should they still be masking? I think that's something that we're still learning about. There's been we had a whole school year where indoor sports were taking place, and we didn't see significant outbreaks related to these school-related activities. So it's hard to say if they still should be masking, because we know that it's hard to mask while you're also physically active.
Yeah, I think that's an important point. It is very difficult, especially indoors. But to your point, too, we knew that extracurricular activities, sports outside of the school were going on, and we didn't see a large uptick that we necessarily knew of when those kids that were actually playing the sports were not wearing masks. But I think it's important that if you go into those venues and you're a spectator, I think it's probably still important to wear the mask.
Okay, question 9. If fully vaccinated, is it safe to eat at restaurants indoors over the long Memorial weekend?
So this is one of the safer activities that the CDC published a few weeks ago. If fully vaccinated, you can eat indoors. I think it goes back to what we've been saying all along. outdoors probably more safe than
Yeah.
indoors, but have some comfort level with being fully vaccinated. I think, and I am fully vaccinated, I still have some degree of, I pay attention to what is the environment within the restaurant, and if chairs are really, really close together, if it's really a lot of people in there,
Yeah.
I probably would choose to either eat outdoors or go to a different restaurant.
Yeah, I think now we're really looking at, if you are fully vaccinated, we're looking at what is your tolerance for risk. If you are fully vaccinated, yes, you will probably be protected from that whole spectrum of disease, even mild symptoms. But what is your comfort level with going into those places where I think you have to assume not 100% of the clients or the workers are vaccinated. So you have to understand there is that risk of exposure. And then again, I've always said individually, what does that mean for me? Although I probably will not get ill or very ill, I probably won't get those blood clots because I'm fully vaccinated. If I do have some sort of sniffle or a cough, even for 1 or 2 days, in what I do in my job, I have to go get tested. And if I'm positive, that means I have to now stay out of work for 10 days, or I have to stay away from my children for 10 days. And that is an individual risk, which I'm not necessarily willing to take right now. But understanding that from the disease standpoint, yes, I will be protected overall from that whole spectrum of disease and those horrible complications of the disease as well.
Okay, and our last question on the theme of Memorial Weekend. If fully with vaccination rates varying widely across Kansas and Missouri, are we just treading water with the COVID-19 infection, and does the long holiday weekend pose a threat?
I don't want to say that we're treading water.
I wouldn't say that.
Unfortunately, I think we're going to wait. We're going to have to wait and see what happens here. Again, to the point earlier, the risk of the get-togethers that we anticipate with Memorial Day weekend are really those who are unvaccinated, and the risk to other unvaccinated folks. So it will be extremely interesting to see 2, 3, 4 weeks from now if there are uptakes in our unvaccinated in the symptomatic population.
Yeah, I mean, but to be fair, we know that there is that subpopulation or that group of people that have been going out and doing things like they have been since the beginning of the pandemic, whether vaccinated or not. So, we have to understand that that has been occurring as well. I think it is, not as fortuitous that this weekend will be a little bit cooler. So if there are get-togethers, they are probably going to be indoors. They aren't going to be outdoors, which we know is safer. But I agree with you. I wouldn't say we're treading water. I think we need to continue in those people that we know to promote vaccination and have them talk and reduce that vaccine hesitancy, really to get everybody vaccinated. Any other community questions? No?
No, we do, but I think we need to move on. If we have time
All
at the end,
right.
I'll ask
Yeah.
1 or 2 more.
All right. Well, as promised, Chelsea Smith has been waiting in the wings to talk with us. The chronic blood shortage has continued into 2021. Can you tell us more about why you think this is happening?
Yeah, absolutely. So blood shortages are not uncommon in the summer months. Typically, Memorial Day marks the beginning of a few very difficult months for us as people are traveling throughout the summer or they're outside just enjoying the weather. They don't really think about coming in and donating blood as often. So we always see a shortage there. However, this shortage is a little different. We've been in a chronic shortage since the onset of the pandemic. Nothing has really changed in 2021, unfortunately. We actually still have not seen over 25,000 blood donors come back. So these donors were donating actively before the pandemic and haven't been back to see us since. We're doing our due diligence to get messaging out to our population to try and let people know, hey, this is a serious situation that's continuing into 2021. It didn't end in 2020. Recently, we actually have seen an uptick in blood usage locally, and we do believe that that's largely due to medical care that's being rescheduled. Medical care that was postponed during the pandemic is now being rescheduled, and surgeries, other procedures that would require blood products, chemo treatments, etc., those are being rescheduled, and we've seen a huge uptick in just the past couple months. So it's put us into even a more dire situation, unfortunately.
Yeah, and we know as the summer months, trauma also, but we know that hospitals around the region have continued to do more surgeries compared to what they were last year as well. So I think that has increased the need, just as you said. So any other specific messages or any other maybe safety protocols you talk about with these maybe hesitant donors as to try and get them back?
Yeah, I noticed a lot of your questions that you received from the community today were regarding masking. I wish that we could get rid of masks. I wish we could safely do that. We are not doing that at the Blood Center. Part of the CDC guidance right now is that medical healthcare situations continue masking. So our donors and staff are going to continue masking to maintain as safe of an environment as we possibly can for our donors. We're still maintaining that social distancing. We're still disinfecting. So if you're one of those 25,000 who haven't been back and you're concerned about safety, COVID-19 infection rates, please don't be concerned about that in one of our donor centers. Arguably, these are probably the safest places you could be in our community right now. Also, one thing to note, if you have been vaccinated for COVID-19, that is not cause for deferral from blood donation. So if you've received Moderna, Pfizer, or J&J, you can still come in and donate. You can actually get the vaccine and come in and donate that very day as long as you're feeling healthy and well.
All right. Well, thank you. Anything else you'd like the public to know, or how can we help?
Yeah, the easiest way you can help is to schedule an appointment to donate blood. I know that there's a population of people out there who might not be eligible to donate for various reasons. If that's you, ask a friend, ask a family member to donate on your behalf. We need donors, very simply put. We also need blood drive locations. We still are not quite back to our pre-pandemic levels for the number of blood drives that we have out in our communities. We're running about 300 to 500 less blood drives this year. It's varied throughout the months, but 2021 is still looking pretty similar to 2020 in terms of blood collection, and that's not good news for us. So simply put, we really need blood donors, and we really need you guys to help spread the word.
All right. Well, we will certainly do that. Thank you.
Thanks. Thank you so much.
All right. So Monday is a holiday we've talked about, and we will not have the morning update, but we will be back Tuesday with Dr. Jeff Burns, who's the co-director of the Kansas University Alzheimer's Disease Center, and he has an update of the impact of COVID-19 on their patients, plus news of a new drug that could receive FDA approval June 7th. If the FDA greenlights aducanumab, another long word. It will be the first new Alzheimer's drug in nearly 19 years. So that is very exciting news for brain health, very exciting news for a lot of people and a lot of families out there. So we'd like to have a big thank you to Keegan and Amber. Amber sent us this pic of Keegan getting his first COVID-19 vaccine. He said he got the shot to help protect his baby sister, his grandparents, his family, and himself. Excellent reasons, Keegan. And you can send us your photo or video of getting COVID-19 vaccine along with why you're getting the shot. You can send via messenger to our Facebook at KU Hospital or email to the Medical News Network at kumc.org. Any final thoughts?
We have a long weekend coming up. I was
know.
really hoping for more sunshine, but I guess gingers should probably stay
Yeah,
out of
right.
the sunshine.
Lots of sunscreen.
But hopefully everyone is planning to do something outdoors this weekend and just really be safe and be really aware and again understand your risk tolerance as you're partaking in these activities. If you yourself have already been vaccinated, take a friend to get vaccinated. I know she was recommending take a friend to get their to donate blood. I think this is a good thing that you can do with the folks that you care about.
Yeah, I agree. You know, it's going to be a nice weekend. Hopefully everybody can relax. Be with friends, be with family, do it in a safe manner. You know, we have been very fortunate here in the Kansas City metro area, I think throughout the pandemic compared to some of the other metro areas around the country. But we can continue to do even better, keep things open, keep less restrictions, do those things we want to do if we can continue to promote the vaccine. If you are not vaccinated, just as Amanda said, please go get vaccinated. Please encourage all of your friends and family to get vaccinated. This is the way that we are going to be able to move out of the pandemic, not only as a region, but as a country, and hopefully as we get more people vaccinated around the world, especially in those countries that are so devastatingly hit right now, that is the way that we are all going to be safe and continue to have things open up and have our economy get back online as well. So please encourage vaccination, and otherwise have a very safe and fun weekend.